Maggie Jo Buchanan. Hi, thank you for the opportunity to testify. I'm the Southern Director of Young Invincibles, and we're a national nonpartisan research organization that focuses on the critical economic issues facing young people aged 18 to 35, otherwise known as millennials, and we get a bad rep in the press, but I am proud to be a member of that generation. And I know everyone's been here for a really long time, and I don't want to belabor any points, but I'm really here, a key part of our organization is working to increase affordable access to health care for young adults. We know there's not a perfect solution on the table, or even probably one that could be negotiated to make everyone happy, but we do agree trying and moving forward is vital. Excuse me. And I'm also freezing, so I apologize if I fidget a little bit. If the state were to take an important step forward and find a solution that works for the state that would increase health care coverage, the possibility is that over 400,000 young adults in the coverage gap could gain access to health insurance for the first time. While it's true that some young adults can stay covered until age 26 by remaining on their parents' health plan, the reality is that just not all young Texans have parents who are insured themselves. And this is similar to something Ann was pointing out earlier. Unfortunately, for many young people, their first jobs are part-time. And so while gaining this type of experience is absolutely essential, it sets them up to acquire soft skills that are going to benefit them through their entire careers, health insurance is just not a part of that benefit. One person we work with very closely out in Houston, he's a full-time UH student, and he's also employed part-time as a trainer. He's one of those people in the coverage gaps. He has made the very difficult decision to forego health insurance to pay his tuition, to make his car payments in order to get to work. Because lacking health insurance is not the only economic challenge young people face. With over 60% of Texas jobs requiring some type of post-secondary education by 2020, young adults are accumulating student debt at a rapid pace. The average senior at a four-year college in Texas owes over $26,000 in student loans. And compounding the fact the unemployment rate for young Texans is triple that of our statewide number, young adults' wages remain down since the Great Recession, despite the fact that wages for Texas's overall workforce have actually gone up since that same time. Perhaps these reasons, taken together, help explain why uninsured young adults are the most likely group to experience serious problems when faced with medical bills. A recent study showed that among young adults who reported problems paying those bills, 32% couldn't pay other debts like student loans or tuition payments, and 31% delayed education or career plans. For uninsured young Texans, a broken leg can mean an end to a college career. And given the importance of completing higher education in today's workforce, that broken leg can hobble Texas families' economic security for years to come. So please, as a personal favor to me, I'd appreciate it if no one here asked my mother when I plan on following suit on the statistic I'm about to say, but America's millennials are increasingly becoming America's parents. In 2014, there were approximately 20.5 million 18 to 34-year-old parents, representing nearly 30% of my generation. As you'd expect, this percentage will grow rapidly in the years to come. Without coverage for hundreds of thousands of young Texans, the care needed to complete our higher education degrees and develop careers that remain out of reach. Excuse me. For those reasons, we strongly urge you to develop a plan that will bring the option of affordable health coverage to more young adults. Thank you again.
I think you need to be talking to Congress and asking them to pass a revision of the ACA that would allow them to properly risk stratify young people based upon their health characteristics and be able to buy a benefit package plan that is the correct plan for that individual at that time of their life.
I welcome the opportunity to always talk to Congress about the issues facing young Texans and young people across the country, but we also have to deal with the problems here at home and the solutions we can tackle. We can't let the perfect get in the way of the good, and expanding coverage would do a great deal of good, and ignoring the problem would do a great deal of harm.
I respectfully believe that your ACA issue and expansion of Medicaid has hurt millennials significantly and will continue to hurt millennials as they age regarding the amount of money they pay in taxes to support Obamacare subsidies and increased taxation for various health care entitlement programs over their lifetime. Thank you.
Thank you.